welcome to Doctors of Medicine. Thank you for joining us. So today we are going to talk about the anatomy of the abdomen. Well, last in our previous sections we were talking about the thorax. So now we are proceeding with the anatomy of the abdomen. Now, where is the abdomen found? So basically, the abdomen is between the pelvic region and the thoracic region. So this is an important site because that's where you find your gastrointestinal organs, the GIT, the liver, the stomach, and everything. So we are going to talk about mainly we are going to focus on the gross anatomy of the abdomen. Right. As we can see here, we are going to define the boundaries of our abdomen using the hexagonal shape. So hexagonal shape is 6 sides, as we know. So superiorly, we have these boundaries. We have the costal margin, which are ribs 7, 9, and 10. Right. And then we have the xiphoid process here. Superiorly of the hexagonal shape, we have the costal margin and the xiphoid process. And then inferiorly, as we can see here, we have what we call the inguinal ligament. We are going to dwell much on this when we are going to talk about the inguinal canal. Then laterally here, we have the mid-axillary lines. We have the axilla, and the axilla, on the axilla, we have anterior axillary lines and posterior axillary lines. So anterior axillary lines, they are made by the folds of the pectoralis major as it attached to the humerus. And then posterior axillary line, they are made by what? The latissimus dorsi. So between the anterior fold and the posterior fold, that's where we find the mid-axillary line. So this being all said, we can also further divide or partition the abdomen into, let me say first, into quadrants. So here we have what's called the umbilicus, right? So we have what we call a median plane running along the middle, right? And then we're also going to have a transumbilical plane, So these planes, they are very important because we're going to divide the abdomen into 4. So we are going to have the right upper quadrant here, and then we are going to have the left upper quadrant here, and then the right lower quadrant here, and then the left lower quadrant here. So this is the transumbilical plane and the median plane. The transumbilical plane is a very important plane because it's going to help us to divide further the abdomen. Where we are going to say we have the supraumbilical region, inferior umbilical region. So yeah, so we can divide them into 4, or we can divide them into 9 regions, as you can see here. So if we are dividing them into 9 regions, we are going to have 2 horizontal lines and 2 vertical lines. Vertical lines, they are easy. We are going to have the mid-clavicular lines, which are 8 centimeters from what? From the median line. So the mid-clavicular line, they're going to form these vertical lines, like this, right? And then we're going to have 2 horizontal lines, where we're going to have the subcostal line here. The subcostal line is the line just inferior to the board of the 10th rib. And then we're going to have, so on the subcostal line, we are saying we have the lower board of the 10th rib, and then that's anteriorly. Then posteriorly, it's bound by lumbar vertebrae 3. So we are going to also have another horizontal line is the transtubercular line. So these will make 9 important regions. 1, 2, 3, 4, 5, 6, 7, 8, and 9. So they are named, they have different names. And also you need also to know the organs that are within these lines, right? Anatomically, it's very important. So here, we are going to have the right hypochondriac, this one. And then here, we are going to have the epigastric region. And then here, we are going to have the left hypochondriac. And then here, on the middle, that's the umbilicus region, right? The umbilical region. And then here we are going to have the right flank or right lumbar region. And then here we're going to have the left flank or left lumbar region. So they are very important because they are organs that are within these regions. And then here, this is the hypochondriac region or the pubic region, depending on the source that you are using. And this one is the right groin or right inguinal region. And this one is the left inguinal region or the left groin, depending on the source that you are using. So these are the regions or the borders that bound the abdominal wall. So we are going to talk mainly about the anterior abdominal wall, the part that we see anteriorly. What do we have? The skin. We are going to talk about the muscles. We are going to talk about the blood vessels and the nerve supply and so forth. So that's what we are going to dwell on. Let's talk about the layers at first, right? We have layers. If we are to dissect the anterior abdominal wall, there are layers that we are going to pierce that are very important that you need to take note of. So obviously we're going to start with the skin, right? So we're going to start with the skin, and then from the skin we are going to go to the superficial fascia. Now the superficial fascia is divided into two. We have a fatty layer that is called fascia of Campbell, and then we also have the membranous layer that is called the scapus fascia. And then from the superficial fascia, we are going to go deep to the muscles. We start with the external oblique muscle, internal oblique muscle, transversus abdominis muscle. And then from transversus abdominis muscle, we are going to have the transversalis fascia. So between these muscles, we are going to have investing fascias that lines these fascias, right? So we have superficial, medial, and deep. So the investing fascia of the transversus abdominis is the one that's going to form the transversus fascia. So from the transversus fascia, we are going to have a layer of fat that is what's called the extraperitoneal fat, right? And then we are going to have now our parietal peritoneum, then parietal cavity, as well as the visceral peritoneum that lines the viscera or the abdominal organs. So we're going to start with the skin. Now the skin is very important because it is what we call Langer's lines. Langer's lines. So they move downward and forward, as you can see here, downward and forward, right? So it's very important to take note of this, that these lines, they also show the orientation of the collagen fibers. So the collagen fibers, remember our skin, we have the collagen fibers, the dermis, and all those things. So the collagen fibers in the dermis, they run parallel to these Langer's lines, right? So if you are to make an incision along, maybe you want to expose the small intestines or any viscera that are in the abdomen, you need to respect these lines. Otherwise, if you cut perpendicular to these lines, you are going to have, the patient is going to have what we call a hipped up scar. I tell you, it won't be beautiful. And then if we are to cut parallel to these lines, the Langer's lines, we are going to have a cosmetic scar which will heal better. So when we are to make an incision in the anterior abdominal wall, we need to make an incision parallel to the Langer's lines in order to form a cosmetic scar. Is it? Right. So that's what is important about the skin. So the skin now is going to be supplied by blood vessels, right? That we need to take note of, right? So it's going to be supplied by blood vessels. So let me just take you to the course. Right, so let's talk about the blood supply, right? Remember we had the heart here, right? And the heart was going to give us an ascending aorta. And then the ascending aorta was going to have the arc of the aorta where it was going to branch, right? Depending on the size, we could have the brachiocephalic artery and what. So here's the aorta. The aorta is going to give what we call the subclavian artery. Let's say this one is the left subclavian artery. So on the first part of the subclavian artery, we have the internal thoracic artery, as you can see here. So it will descend behind the costal margin, posterior to the costal margins, which is a finger breadth to the midline, right? So the internal thoracic artery at the level of the sixth intercostal space, it was going to terminate into two, where it would give us the musculophrenic artery. This would supply the ribs, the intercostal space 7, 9, and 10, if you remember. There's a musculophrenic artery. The musculophrenic artery would later pierce the diaphragm and also supply the lateral part of the what we're going to talk about here. The right and the left hypochondria will be supplied by the musculophrenic. So it will split and give us the superior epigastric artery. The superior epigastric artery, it will pass through between the costal origin and the sternal origin of the diaphragm. So there is a space there. So it will pass through the space and then it enters the abdomen. When it enters the abdomen, it's going to pierce into what you call the rectus sheath. We are going to talk about it very soon. It pierces through the rectus sheath and then it goes posterior to all the anterior lateral muscles. And then it goes to what you call the umbilical region. Yeah, the umbilical region. So that's the superior epigastric. So it's going to anastomose with its partner, the inferior epigastric artery. Where is it coming from? Let's go here. So remember, we have the aorta. The aorta was going to pass through the aortic opening at the teat cord. And then it was going to continue as the abdominal aorta. So the abdominal aorta is going to split at the lumbar 4 vertebrae into two branches. We are going to have the common iliac artery. The common iliac artery is going to further branch into two, what's called the external iliac artery and the internal iliac artery. The external iliac artery is the one that we want to focus on. The internal iliac artery, we are going to focus it later when we're going to talk about the lower limb. Is it? So the external iliac artery is going to give us two important branches. These are deep branches. So it's going to give us one, what we call the inferior epigastric artery. So the inferior epigastric artery, here's the cause. The inferior epigastric artery, it goes posterior to the rectus abdominis. As it goes posterior to the rectus abdominis, it is going to pierce the rectus sheath at the level of what we call the arcuate line. I'm going to mention this, the arcuate line, and then it enters the rectus sheath. And then around the umbilical region, it's going to anastomose with this partner, the superior epigastric artery. They're going to anastomose like this, at this region, right? So then we have another branch that is given by the external iliac artery. That is the circumflex iliac artery. So the circumflex iliac artery is going to sort of like encircle the iliac fossa, as well as it supplies the inguinal region, right? So those are two important branches from the external iliac artery. So we are going to, as we said here before, we said that at the inferior aspect of the hexagonal shape, we have the inguinal ligament. So the inguinal ligament, this external iliac artery, as it passes the inguinal ligament, is going to change its name, right? Just like the aorta, as it passed through the articular opening, would say it's now the abdominal aorta. So this one, as it passed through or posterior to the inguinal ligament, it is now given a name called the femoral artery. So the femoral artery is going to give it three important branches. These are superficial branches, all of them. They are superficial branches. So as you can see here, so this one is our inguinal ligament. This one is our external iliac artery. So as it passes posterior to the inguinal ligament, we now call it the femoral artery. The femoral artery is going to give us three superficial branches. One being the superficial external pudendal artery. That's going to supply the pelvic area. And then we're going to have the superior circumflex artery. That's also going to supply the inguinal region. And then we're going to have the superficial epigastric artery. Right. So these are the arteries that we are going to have from the femoral artery. Right. So as we can see here, like I said, these arteries, they are accompanied by veins. Is it? They are accompanied by veins, right? So wherever there is an artery, there is a vein. Right. So, but one of the most important veins that we have to talk about are these ones that I've highlighted here. They are very important. So we are going to have, since we have the femoral artery, we are going to have the femoral vein. So the femoral vein is going to give a branch, a superficial branch, what we call the superficial epigastric vein. So the superficial epigastric vein is going to anastomose at the lateral aspect of the abdominal, of the abdomen, is going to anastomose with what we call the lateral thoracic vein. And then they are going to form what we call a thoraco-epigastric vein. So the lateral thoracic vein comes from the second part of the axillary vein, from upper limb there. Do you still remember? So this lateral thoracic vein, remember, it will supply some branches to the lateral quadrants of the breast, as well it will descend downward and anastomose the superior epigastric vein and form the thoraco-epigastric vein. So these are very important clinically, right? So these are the veins. So here at the umbilicus, we are going to have radial veins that seem like to come from the umbilicus, and then they have a relationship with the liver. So these umbilical veins that come from the umbilicus, they are called the para-umbilical veins. Listen here very carefully. The umbilicus, embryologically, is attached to the umbilical cord. In the umbilical cord with the umbilical vein. The umbilical vein will move superiorly to the umbilicus, right? And then it is enclosed by what we call the falciform ligament. So it will, after birth or postnatally, it will become what we call the ligamentum teres hepatis. So the ligamentum teres hepatis postnatally will accompany what we call para-umbilical veins. So these para-umbilical veins, they seem to originate from the umbilicus. And then they have important communication with the portal veins. We are going to talk about the liver. So the para-umbilical veins, they move with the ligamentum teres hepatis, and they have important communication with the portal vein. So they will form what's called the portal systemic venous plexus. The portal systemic venous plexus, right, is very important, right? So clinically, let's say that this patient has been drinking a lot, and then there is fibrosis in the liver, whereby there is maybe death of the hepatocytes and so forth. So we are going to occlude the venous drainage in the liver, the portal venous drainage in the liver. So if we occlude this, we are going to have a serious situation where the blood it has to find an alternative way. So since these para-umbilical veins, they have communication with the portal veins, and also we also have the communication with the femoral vein, the superficial epigastric vein, and the lateral thoracic vein. So the blood in this vein is going to look for an alternative route, whereby it's going to pass from the liver, para-umbilical vein, to the superior epigastric vein, lateral thoracic vein, axillary vein, and then axillary vein, where does it drain into? It's going to continue the subclavian vein, the brachiocephalic vein, superior vena cava, and then the heart. So we are going to have dilatations of these para-umbilical veins as well as the thoraco-epigastric veins. So these dilatations of these veins is going to cause what you call caput medusa, right? So you're going to have you can see it superficially, the dilatations of these veins. So let us talk about the blood supply to the skin, right? So we are going to divide the skin into 3 regions or zones per se. These are zones that are called Hagen's zones, right? So we have 3 of them. We have this one that we call zone number 1, and then we have this one that we call zone number 2, and then we have this one last one that we call zone number 3. So we are going to start with the zone number 1. So as I said, that we are going to have the superior epigastric artery that is going to anastomose with the inferior epigastric artery, around the umbilicus region. So these, they are going to anastomose deep to all the muscles of the anterior abdominal wall, deep to the rectus abdominis, deep to the aponeurosis and all those things of all the muscles, right? So they are going to anastomose. As they anastomose, they are going to give perforating branches that are going to pierce those muscles as well as supply the what? The skin around zone 1. So the superior epigastric artery, inferior epigastric artery, they supply the skin that is around zone 1. And then we go to the zone 2 here. Zone 2 here, we are going to have, is going to be supplied by branches, superficial branches of the femoral artery. We spoke of the femoral artery, we said it is a continuation of the external iliac artery posterior to the inguinal ligament. We are going to have 3 branches, superficial branches, which means they are moving in the subcutaneous layer of the skin, is it? So we are going to have superficial external pudendal artery, superficial inferior epigastric artery, superficial circumflex iliac artery. So these are the ones that supply the skin that is around this region, which we call zone 2, right? And then we are going to have this lateral region, this one, right? It's going to be named zone 3. So this one is zone 3. So we are going to have the abdominal aorta. So the abdominal aorta is going to give us what we call lumbar arteries. So we have 4 of them that will supply the lateral aspect of the what? Of the abdomen. As well, we also have 2 intercostal arteries. 2 of them, 10th and 11th. The 12th artery is not an intercostal artery. And yeah, so we are going to have the 10th and the 11th posterior intercostal arteries supplying the lateral aspect, which is zone 3, as well as the subcostal artery. So this is zone 1, superior epigastric artery, inferior epigastric artery. So zone 2, then zone 3, branches of the abdominal aorta, 4 lumbar arteries, 2 posterior intercostal arteries, 10 and 11, and then 1 subcostal artery. So yeah, this is the arterial supply to the skin. Alright, so guys, let's talk about the umbilical folds. Right, so if we were to dissect and then we look the parietal peritoneum from within, we are going to see folds, right? So I tried to draw here so that you can just have a picture of what it looks like, right? So here, this is the umbilicus, right? So the region that is above the umbilicus is called supra-umbilical region. And then the region that is below, that is called the infra-umbilical region. So there are folds that are found in the supra-umbilical region. Let me start with the falciform ligament. So the falciform ligament, embryologically, it comes from the ventral mesentery. And then it is split by the development of the liver. And then it's going to split the falciform ligament that attaches the liver from the anterior body wall. It attaches the liver to the anterior body wall. So that's the falciform ligament. So what does it contain? No, the falciform ligament, it has these, as you can see these, where I'm going to talk later, these are the umbilical veins. The umbilical veins, they are going to fuse and then they are going to form, they are going to be surrounded by this falciform ligament. So it will contain the remnant of the umbilical vein that will later be called the ligamentum teres hepatis. So that's the falciform ligament, supra-umbilical region. So infra-umbilical region, we have 5 folds. 1, 2, 3, 4, 5. We have 2 lateral, 2 medial, 1 median. So I'll start with the median. So this is the bladder, this is the bladder, this is the umbilicus, right? So embryologically, there is a connection between the apex of the bladder and the umbilicus that we call the urachus. So the remnant of this urachus is called the median umbilical ligament. The median umbilical ligament. So it's the one that forms this fold, right? So at the other side, we are going to have a fossa that is called the supravesical fossa. Yeah, you just need to take note of this. This is the fossa, right, at the other side of this median, right, umbilical ligament. Right. So we are going to have another folds bilaterally. We are going to have what we call the medial umbilical folds. Medial umbilical folds, now these are formed by occluded umbilical veins. Occluded umbilical veins. So if you cut these, they don't bleed. if you cut this, don't bleed. But if you go now to the lateral umbilical fold, the lateral umbilical fold, it contains or it accompanies or it encloses what you call the inferior epigastric vessels. The inferior epigastric vessels, remember, they are coming from the external iliac arteries. So they are going to run within this lateral umbilical fossa. So if you are going to cut the lateral umbilical fossa, it's going to bleed, right? So we have three forces: the supravesical fossa, that is between the median and the medial. And then we're going to have what you call the medial inguinal fossa, very important. That is between the medial and the lateral. And then we're going to have the lateral inguinal fossa, from the lateral umbilical folds. So let's focus a bit on the medial inguinal fossa. So in the medial inguinal fossa, we're going to find what you call the Hazelbeck triangle, or simply the inguinal triangle here. It's found in the medial inguinal fossa between the medial umbilical fold and the lateral umbilical fold. So what are the boundaries of the inguinal triangle? The inguinal triangle, as you can see here, right here, let's say this one, this boundary, this border is made by the medial border. Let me say the medial border is made by the lateral edge of the rectus abdominis as it curves, right? So the lateral edge of the rectus abdominis forms the medial border, and then the lateral border is going to be formed by the inferior epigastric vessels. Since we say the lateral umbilical fold is formed by inferior epigastric vessels, so the lateral border of the inguinal triangle is formed by the inferior epigastric vessels, both the artery and the vein. But the more medial. The one that is more medial is the vein. So we're going to have the vein and then the artery, forming the lateral border of the inguinal triangle. And then the inferior border, remember here we have the inguinal ligament. So the inferior border is formed by the inguinal ligament. So that's the triangle. It's very important, whereby that's where you're going to find what you call direct hernia, which is less common, is it? And then here, the lateral inguinal fossa, this one. So the lateral inguinal fossa, we are going to have the transversalis fascia, and then we are going to have an opening in the transversalis fascia that is going to form the deep inguinal ring. So the deep inguinal ring is lateral to the lateral umbilical fold. What is in the lateral umbilical fold? That is inferior epigastric arteries and vessels. So the deep inguinal ring is lateral. So that's the potential site of indirect herniation. That is what? That is common. We are going to have another video about indirect and direct herniation, so you get to appreciate this more. So right to say, just a summary, we have 5 infra-umbilical. In the infra-umbilical region, we have 5 umbilical folds. The median umbilical fold, formed by the remnant of the urachus. That will be the median umbilical ligament. The medial umbilical fold, formed by the occluded umbilical veins, right? And then we're going to have the lateral umbilical fold, which if it is cut, will bleed. All of these, if they are cut, they won't bleed. But this one, if it is cut, it will bleed. So thank you so much. See you next lecture series.